Hello, I'm Dr. Megan Lasaponara, and for today's installment of our newborn series, we're going to talk about safety in the first year of life. Your baby is going to grow by leaps and bounds in this first year, and the safety concerns as they grow are definitely going to change. From somebody who's very stationary and reliant on you for all sorts of movement to a 1-year-old who is getting into all sorts of trouble in different areas of the house because they can walk around. One early issue with safety can be the changing table. So something that's recommended is a changing table that has a 2-inch guardrail on all 4 sides, a concave changing pad so that it is lower in the middle and higher up on the sides, and then a buckle to buckle the baby in with. Now obviously those things aren't foolproof, and once babies are rolling all over the place, it can be really hard to keep them safe on the changing table. So keeping diapering supplies very much within reach is super important. And then if at any time you're concerned that you cannot keep them safe while you're changing them, putting them on the floor on a changing pad is completely reasonable. Second thing that we like to talk about with baby safety is walkers. So those are the saucers with the wheels on the bottom that babies sort of sit in and propel themselves around. They can be very unsafe, and the American Academy of Pediatrics actually recommends not having them on the market at all. The things that we get concerned about are babies really can't see where they're going, and while some of those products have brakes on them to stop them from going downstairs, certainly babies do get injured quite a bit when they fall downstairs in a walker, and they can land on their heads, they can fall into pools. There are a lot of potential dangers with having babies that small pushing themselves around. Another issue can be they bump into things, so things like tables, stoves. They can have lamps and other high up objects fall on them, and then also anything that's hot on the stove surface could certainly fall on them at any time. And so we like to either pull the wheels off of those so that they're stationary and can play in them, or get one of the stationary Xer saucers is certainly another reasonable thing to think about. Sort of along those same lines, we see a lot of accidental burns within the first year. Those can occur when a baby gets put into bath water that's a little bit too hot, or certainly they can be exposed to burns from, again, things falling down on the stove that they're trying to reach up and grab, or hot beverages that are around, like soups, coffees, things like that, that they see you drinking and they certainly want to share, and they can pour them down on top of themselves and cause burns. Other things to be mindful of certainly are curling irons, clothes irons, other heated things like that. Babies, especially in the first year, can just grab a cord and get a hold of those things before you even know what's happened. So it is a cause of injury and even ICU admissions for children, and it's something that we like to keep parents aware of. One thing to think about before your baby's crawling or walking is child proofing. Now, when you bring home this tiny little bundle of joy and they're not doing too much, it's easy to sort of put that off. But before they get to the point where they're going to get into things, it's a good time to invest in plug covers, and then go room by room in your house and think about things that could be dangers. So if we start in the kitchen, obviously you have a lot of cleaning supplies that you wouldn't want a child to get into. Locking cabinets or putting things up so high that they can't be reached is recommended. Do keep in mind that there are a lot of those single-use dishwasher and clothes washer pods on the market now that look like they could be candy because they're very colorful appearing. So those things especially may seem like they're safer because they're in a protective pod, but they definitely need to be kept up and out of the reach of young children. Personal hygiene products like cosmetics, nail polish removers, mouthwash, perfumes also should be kept up out of the way, because those are things that children could drink or ingest before you even know what's going on. And so keeping those things that you tend to pay attention to away from them, because that entices children even more, is a great idea. The garage is a place that sometimes gets overlooked because you feel like your baby's not really going to be outside near those things, but antifreeze, gasoline, windshield washer fluid, kerosene, those types of things definitely need to be stored in a safe cabinet because they are very high risk of injury with consumption by children. Medicines are things that we maybe don't think about, but even vitamins, so vitamin gummies, other things like that that could be tempting to a child and that they could overdose on because they're going to eat like the whole bottle of gummy vitamins are worth storing up out of the way. And then things that we don't think about, like trash cans. They can be a place that children can get into stuff that they're not supposed to. So putting them in a place that is safer and out of the way, in a closet or a cabinet that's locked, while it may impinge on your ability to easily access the trash, it will also keep your child out of it. So it's worth thinking about doing that. Last but not least, one thing that parents like to ask about is pet safety. When is a good time to get a pet? What should we do about the pet that we have before we bring our baby home? And the answer is, this sort of is different for every family. But if you're going to bring a new pet into a home with a baby, you might want to get an older animal. Puppies and kittens tend to nip and bite when they're playing and when they're just sort of learning the rules of the road out in the world. And so keeping them away from babies is a great idea because of that nipping behavior. Even a pet that you trust probably shouldn't be left alone with your child. One thing that can happen is children don't pick up on the clues that a pet is overstimulated or anxious, and they can continue to want to play or get in the pet's face. Something that when the pet is normally calm would be fine can quickly become an issue. One additional thing to think about is to be mindful of startling pets. Children, especially those that are familiar with a pet because they've grown up with it, can go over to a sleeping animal and startle it and scare it. And so making sure that your child knows that when the dog is sleeping, we leave the dog alone, or the cat, is a very good time investment. And then obviously not letting your child taunt or play with the dog's toys or food or ball or pull their tail. Trying to keep the child from doing those things. Obviously with a 9-month-old or a 1-year-old, it's hard to explain that, but then keeping them out of a situation where they would be able to do those things is key. Now today I've just sort of touched on 5 different areas that we think about with first year safety. Obviously there are a ton of things that can happen in the first year of life that we could address here. If you have questions or concerns, if there are other areas that you feel like you'd like to address, contact your pediatrician, contact your child's doctor, and ask at any time. And obviously, if you have questions and you're one of our patients, we are happy to see you at English Road Pediatrics at any time. Have a great day. Bye.